A 26-year-old male presented to the emergency department after being hit by a fast-moving vehicle on the road. The patient fell onto his right side and can now not move his right arm. He feels intense pain in right forearm, especially along the medial border, distally till the fifth finger. The patient cannot flex and pronate his right forearm. On physical examination, injury to the anterior compartment of the forearm is suspected. Which of the following statement best describes the anatomy of the forearm? Median nerve courses superficially on the flexor muscles of the fingers. Let's see about the first option. Median nerve courses superficially on the flexor muscles of the fingers. Actually, ulnar artery is on the medial side. Median nerve is lateral to the ulnar artery in the forearm. Median nerve is lateral to the ulnar artery in the forearm. And look here. Then along with the ulnar artery, it passes beneath deep to the fibrous arch joining the two heads of flexor digitorum superficialis and runs deep to this muscle on the surface of flexor digitorum profundus. So however, it is running deep to the flexor muscles of the fingers, not superficially. Pronator quadratus lies deep to the long flexor tendons proximal to the wrist. Yes, of course it is right. Pronator quadratus, it takes origin from an oblique ridge on the lower 1/4 of the anterior surface of the ulna, and it is inserted in the lower 1/4 of the anterior surface of the radius. It takes origin from ulna and it is inserted into the anterior surface of the radius. Ulnar nerve is superficial to flexor carpi ulnaris muscle. Ulnar enters the front of the forearm by passing through the gap between two heads of flexor carpi ulnaris. Yes, of course. So it is not lying superficially. It is passing through the gap between the two heads of flexor carpi ulnaris. It then runs downward on the medial side of the forearm between flexor carpi ulnaris and flexor digitorum profundus, which is a deep muscle. It enters the palm of the hand by passing in front of the flexor retinaculum. Next, in the distal two-third of the forearm, the ulnar artery is lateral to the ulnar nerve. See here, this is ulnar artery which is lateral to ulnar nerve in the distal two-third of the forearm. So third statement is wrong. So the correct answer is option B.